Hello, my name is Adrian. I'm currently a dialysis nurse at the VA Medical Center here in Las Vegas. I mainly focus on giving hemodialysis, and I'm working on improving that care for veterans with end-stage kidney disease and acute kidney failure. Today I present my change project aimed at reducing interdialytic weight gain and improving dialysis adequacy through a veteran-centered, literacy-focused education bundle with coordinated transportation and mental health support. My PCOT question is, in VA hemodialysis patients, does a veteran-centered literacy-focused education program plus coordinated transportation and mental health support compared with usual care and reduce interdialytic weight gain, which is the weight gained in between dialysis sessions, and improve KT over V, which is how well the patient's blood is getting cleaned in over 3 months? So the current practice is education is inconsistent, varies by nurse, and it isn't tailored for low health literacy so that teaching can be done through all educational backgrounds. Transportation barriers and untreated mental health issues often go unaddressed. We already measure patient weights and KT/V, but we lack a standard simple education workflow and reliable referral triggers for social needs. So literature shows tailored education and nutritional counseling reduce interdialytic weight gain short term. Health literacy is linked to self-management, and feasibility pilots work best when short, pictorial, and staff-friendly. Key literature findings are health literacy is strongly linked to patients' disease knowledge and self-management ability. So clear, simple teaching helps patients act on advice. Number two, individualized education and nutritional counseling can reduce interdialytic weight gain and improve dialysis metrics in the short term. Feasibility trials show that short sessions and pictorial handouts are acceptable to older dialysis patients and more likely to be used by staff. So the intervention is a 12-week pilot on one dialysis shift using 3 weekly 5-minute teach-back education touchpoints during dialysis, a one-page pictorial handout with fluid goals, sodium tips, and food and drink cheat sheet included, automatic social work referral triggers for recurring high interdialytic weight gain or missed rides, and readiness and delirium checks before teach back and brief dietitian-led training for staff. So the purpose is the bundle combines health literacy principles, individualized teaching, individualized counseling, and interdisciplinary supports recommended by the evidence. So it keeps the session short and practical so nurses can sustain it, which makes it more likely to become part of the routine. So the pilot is limited to one shift because we want to test its feasibility, reduce burden, then can scale up using lessons learned. And that was a suggestion by my mentor, which is the nurse manager. So the timeline for the implementation. So even before we start implementing it, we finalize the handout with a dietitian and we do staff training. Um, in weeks 1 to 4, we enroll 10 to 15 veterans on pilot shift, deliver 3 weekly teach-back sessions, document interdialytic weight gain and KT/V. In weeks 5 to 8, we continue education, run weekly huddles to fix problems, trigger social work referrals as needed. And by weeks 9 to 12, we collect final outcomes, share unit level results, and plan scale up or revisions. So the key operational steps include stakeholder input, like input from nephrology, nurse practitioner, dietitian, social work, micro training sessions with nursing staff, weekly audits, and monthly team reviews. So process measures is a percent of enrolled patients completing all three teachback sessions on the pilot shift. Clinical measures include mean interdialytic weight gain decrease and average KT over V improvement. Balancing measures include nurses' input on time burden and social work referrals volume. So I only got to the point of having a meeting session with a dietitian about what lessons to include on the handouts, formatting the readiness and delirium checks, and speaking with my mentor about implementing this change project. But realistic goals include an 85% completion rate with the three teachback sessions, I interdialytic weight gain decrease of negative zero point 0.6 kilograms and KT/ORV increase of 1.3, uh, with nurses reporting no significant strain on workload and increased social work referrals volume. Lessons in implementation include implementation is not a one-time event. It needs ongoing measurement, feedback loops, and flexibility. Designing for how nurses actually work matters more than how comprehensive the program could be. So small, repeatable changes are more likely to be adapted. And getting the dietitian, social work, uh, nurse practitioner, nephrologist involved early on is essential to creating a realistic workflow and safety checks. So this project showed that targeted literacy-focused education combined with system support can be implemented in a busy VA dialysis unit and produce measurable improvements. Moving forward, I plan to start training and test sustainability over a longer period. Uh, Thank you so much, and have a good day.